in hospitals for what's coming. Those 40 unvaccinated adults have a good chance of getting COVID 19, and some of you will get very sick. That'll mean hospitals are going to get extremely stressed again, both in terms of equipment as well as personnel to care for those who get sick. That's why my administration has stockpiled and pre-positioned millions of gowns, gloves, masks, and ventilators. We call it PPP. We're ready to send them immediately to any state that needs more. In addition, I've directed the Pentagon to mobilize an additional 1,000 troops to be deployed to help staff local hospitals and expand capacity. That's 1,000 military doctors, nurses, and medics. We've already started moving medical teams. They've already landed in Wisconsin and Indiana this week. This is on top of 300 federal medical personnel that are now on the ground, having deployed since we learned about Omicron. Look, while we know staffing is the biggest need for hospitals, some may need more beds as well. We're prepared. I've directed FEMA to activate the National Response Center and begin deploying teams now to provide additional hospital beds. We'll begin to construct emergency capacities near hospitals and parking garages and nearby buildings to be ready if needed. And the federal government is paying for all of this, period, all of it. Further, FEMA will deploy hundreds of ambulances and EMS crews so that if one hospital fills up, we can transport patients to beds elsewhere. This week, we'll send dozens of ambulances to New York and Maine because the COVID is spreading transport patients. Our doctors, nurses, hospital staffs have gone above and beyond during this pandemic. The strain and stress is real. I really mean it. It's real. We'll have their backs, though. We have to let them know we have their backs. Finally, we're making sure that COVID-19 no longer closes businesses or schools. Last week, the federal court reinstated my administration's vaccination or test rule for businesses with more than 100 employees. The rule requires employers with 100 or more employees to protect their workers who are on site and indoors with the requirement that they be vaccinated or tested each week or go home. These rules are going to keep workers safe, and keep workers safe will help keep businesses open. When people are vaccinated or tested, they are much less likely to get sick and less likely to spread it to others. Customers are more likely to come in and shop because they know it's a safe environment. I know vaccination requirements are unpopular for many, not even popular for those who are anxious to get them. My administration has put them in place not to control your life, but to save your life and the lives of others. Where 400,000 Americans died from COVID this calendar year, and almost all were unvaccinated. Almost all were preventable. The rule is legal and effective. It's going to save thousands of American lives. We must also keep our K-12 schools open. Look, the science is clear and overwhelming. We know how to keep our kids safe from COVID-19 in school. K through 12 schools should be open, and that safety is increased if schools require all adults who work in the schools to get vaccinated and take the safety measure that the CDC has recommended, including masking. I got Congress to pass billions of dollars in school improvements, ventilation, and social distancing. Schools should be safer than ever from COVID-19. And just Friday, the CDC issued a test to stay guidelines. So schools can stay open and kids can stay in class even if a classmate tests positive. COVID-19 is scary, but the science is clear. Children are as safe in schools as they are any place.